Hello and welcome to Connected with Latham, where we discuss ideas, legal developments, and business trends shaping the global economy. This is the 22nd episode of the Latham & Watkins Drug Pricing and Market Access series, and I'm Chris Schott, a partner in the healthcare and life sciences practice in our Washington, D.C. office. I focus my practice on all things market access, and that includes manufacturer compliance related to the Medicaid Drug Rebate Program, Medicare Parts B and D, and the 340B Drug Pricing Program. I also advise on current policy initiatives, such as Most Favored Nation drug pricing policy issues, the ongoing implementation of the Inflation Reduction Act, as well as state law developments. And joining me is Danny Machado, an associate in our Washington, D.C. office.
Hey, Chris, how's it going? And quick reminder to all our listeners that we are publishing the Latham & Watkins Drug Pricing Digest every second Monday. Things are moving really fast in the policy arena. And while we do our best to try to stay current with our podcasts, you can also hit the digest every other week for current developments. We actually just published issue number 58, so definitely make sure to take a look.
Thanks, Danny. And today we're very happy to welcome Eliza Biedziak from Ernst Young as a guest. We've worked with Eliza on many projects over the years, and that makes it a particular honor that she's joining the podcast today. Eliza, do you want to introduce yourself?
Thank you, Chris. Hi, I'm Eliza Biedziak. I'm a managing director at EY. I specialize in pharmaceutical government pricing, working with manufacturers, biotech firms, and medical device companies. I have performed numerous compliance assessment and recalculations for the U.S. government healthcare reimbursement and drug discount programs, otherwise government pricing programs. I have also supported voluntary disclosure efforts related to government pricing, prepared findings, and refund calculations. Participating in follow-up agency assessment is also a part of the work that I do. I'm very passionate about helping our clients navigate the complexities of pharmaceutical pricing and compliance, and I look forward to sharing my insights with you today.
Well, thank you, and thank you again for joining our podcast today. In each episode, we focus on a specific topic that is relevant to market access, drug pricing, or the pharmaceutical and healthcare sectors more broadly. And after discussing the substance, we ask the question, which Olympic sport is it like? And we have the list of Olympic sports here to see which most resembles the topic in terms of strategy, complexity, or level of conflict. So, Danny, what is our topic for today?
Today, we're going to discuss government pricing assessments, specifically what they are, how they work, what to expect, and their benefits.
Thanks, Danny. And we've had a few topics here recently on the podcast that were kind of more broadly focused on market access and other aspects of the pharmaceutical industry. But today we're kind of getting back to a bit of a more of a hardcore government price reporting topic. And maybe I can set up the context a little bit. So we talk here about government pricing. We shorten it to GP because acronyms are the fuel that we all operate on in the drug pricing world. So a GP assessment is really an internal review of the GP function at a pharmaceutical manufacturer. And so why do this from time to time, every few years? What makes sense here? Why is this an important process? And I would say it's important because if there is an issue, if there is some incongruity, something going on, it's better to find it in-house and fix it rather than having the government, for example, do an audit or discover an issue, because that brings a host of other consequences that can better be avoided. So let's also maybe consider, let's call them the players that are involved in a GP assessment. So typically those include outside counsel, and the role of outside counsel would be to apply the overarching legal standards that relate to the GP space and to make sure those are applied as part of the audit and the evaluation, and also to guard privilege of the assessment. Then there's typically an outside consultant, such as Ernst Young, to look at the actual numbers and the mechanics, to really look under the hood and conduct the interviews and fact-finding that happen with the company. And then, of course, the company group or department that runs the GP function is integrally involved in conducting an assessment. Finally, if the manufacturer uses an outside GP service provider, then that also is an important stakeholder to provide information and give background on how things are operated at the company.
That all makes sense, Chris, and that's really good to set the background. And today we're very fortunate to have Eliza with us, who has performed a ton of these in the role of outside consultant. Eliza, I wonder if we could start by asking you, what role does an external consulting company typically play in the assessment process?
Yes, Danny. So consultants or advisors can play a valuable role in government pricing assessments by bringing specialized knowledge and expertise and impartial viewpoint in this very highly regulated area. Government pricing advisors conduct a thorough testing, analysis, identify potential gaps, and provide insights into industry practices to help clients achieve compliance with government requirements. And we help our clients identify opportunities to achieve savings. We also can help formulate remediation plans, which we tailor to their organizational needs, drawing on our expertise and knowledge of all these regulatory frameworks. Advisors also provide documentation to help facilitate seamless communication with internal and external stakeholders, and we proactively highlight observations that may be pertinent to counsel, like you and Chris, and facilitate subsequent discussions about the findings and recommendations.
Yeah, thanks, Eliza. And you mentioned the impartial viewpoint that you can bring to the table here. And I think that's something maybe I should have highlighted when going through the participants in a GP assessment. Why outside counsel? Why an outside consultant? Well, it is to have a new look, a fresh look, and of course, an impartial look at the GP function. So once the manufacturer has decided to conduct a GP assessment, maybe it's part of a regular cycle that's being run every few years. Maybe it's after there have been some major changes in the commercial model that make it necessary to assess everything. Or also, frankly, it's possible that there was a problem that was discovered and now it's necessary to find out what the scope of that is. So, how do you and your teams typically approach the GP assessments that you're involved in?
So we view these government pricing assessment as a collaborative initiatives that can serve as a catalyst for process optimizations for the manufacturers that we work with. So following government pricing assessment, manufacturers should receive a very well organized framework if they are collaborating with professionals who have repeatedly navigated similar assessments. Our analysis and professional insights can enhance compliance understanding, but also advance operational efficiency and effectiveness. The scope and duration of government pricing assessments may vary depending on the complexity of the project. At EY, we take a distinctive approach that emphasizes close collaborations with the manufacturer, but also external counsel, for example, the scope design phase. This allows us to define the sample selections, the specific periods for testing, what calculations will be performed, and what products are in scope. This level of detail can extend to multiple facets of the calculations we do, whether through replications or alternative methodologies that we use for testing.
So definitely, Eliza, here on the question of scope that you mentioned, which periods, which ones of the federal programs, etc. This is all highly important. Maybe if there's been a comprehensive GP assessment recently, but the manufacturer just expanded presence in maybe one of the federal programs, then it would make sense to focus just on that program and its price types, right? And just to do a specific product. But Eliza, from a process standpoint, are there kind of phases in the GP assessment that you would expect to see in a typical assessment?
So, the methodology that we typically deploy is kind of structured into three distinct phases. The first one will be fact finding, discovery, and risk assessment, followed by focus analysis and testing. And the last one would be the findings and recommendations. So, in this initial phase, which is the fact finding, discovery, and risk assessment, we conduct comprehensive stakeholder interviews, conduct comparative analysis of documented policies versus actual practices. We also perform process walkthroughs to identify potential compliance gaps. To provide more context around this process, I'd like to describe this a little bit more. During this examination, we seek to obtain and critically analyze policy and procedures in place for government pricing programs. We identify, acquire, and evaluate transactional master data from source systems that are basis for these government pricing calculations. We also gain a thorough understanding of the processes, systems, internal, external data sources used, and then finally, we benchmark the current methodologies operations against applicable government regulations with your guidance and industry practices. Then this leads us to the subsequent phase of which is the focus analysis and testing, where we gather and analyze transactional and supporting data, conduct targeted assessment procedures that are informed by the preliminary observations that we gathered from the first phase. And this phase also includes replicating calculations or maybe testing specific aspects of calculations for the sample periods or products that we've agreed upon.
Yeah, thanks, Eliza. Very helpful to kind of understand sort of the phases a little bit more in more detail. And like we said before, there's a lot of cooperation here between you as the outside consultant with the company, of course, itself, where they provide the necessary documents, data, access to the right people, and then of course folks like us as outside counsel. And where we would then, as outside counsel, play the bigger part is in the assessment of the methodologies, where we would kind of review them in light of the current binding legal standards that are out there. And then you also mentioned replicating calculations. So maybe just to amplify this a little bit, let's take best price, right? So the manufacturer will have a methodology for determining best price, and typically there's software of some sort that embodies this methodology and that runs every quarter to then actually determine best price. So, typically we would get from the company that methodology document that explains what they do. We would probably get the input data for one or maybe more quarters on specific products. And then, you as the outside consultant would kind of reperform this best price determination. You would separately and outside of the company system in your own system, use the data, use the methodology, and just run that and see what the outcome is. And of course, the goal is to see if, as long as you follow the company methodology, do you get the same best result, or is there a variance? And if there is a variance, what does that come from, right? So that's really the value of having the sort of parallel calculation or recalculation.
Right. And so now suppose, let's say the process has run its course. The outside consultant, Eliza, and outside counsel, us, for instance, have reviewed the methodologies and we've done these parallel calculations that we're talking about. Then, Eliza, how are the takeaways and observations documented? Or, kind of said in another way, what would be the output of a GP assessment?
So typically the primary output is a kind of a comprehensive findings and recommendations report, which may be developed using sometimes company established templates or our EY format. And the report encompasses critical components such as engagement scope, an executive summary, detailed findings, actionable recommendations, as well as calculation replication results when that is a part of the scope assessment. And the findings and recommendations are systematically structured around 5 elements. The first element is the government pricing subject area, which identifies specific criteria and under examination. For example, data completeness and validations, master data, or calculation methodology. The second item is a standard or measure. Here, in the second aspect, we articulate the benchmarks used in our assessment, which may include regulatory requirements, documented policies, or recognized leading practices. The third is the observation or finding, where we provide an explanation of the factual evidence uncovered during the assessment. And we offer clarity on the current state of compliance for a subject area. So let me give you a couple of examples. When looking at a subject area such as data completeness, We may note that the company doesn't reconcile the data relied upon in government pricing calculations to the source systems. To provide another example, in case of a calculation methodology, we may note that the company doesn't perform best price true up, or maybe the estimation or lack price concession is not in line with rules and regulations. Then let's go to the fourth element, which looks at the potential risk or exposure. We detail the potential risks or exposure that a manufacturer may face if the identified conditions deviate from the established criteria, emphasizing the implications of such discrepancies. And finally, we present a detailed outline of the recommended actions that the client should take to address the findings and mitigate the identified risks. And in some cases, we may also identify practices for enhancements. Just in the summary, this kind of a structured approach leads to a creation of a report that can serve as an instrument for a strategic guide for our client for the upcoming remediation plan.
That all makes sense, Eliza, and it's a great explanation, very detailed. And Chris, maybe this is a follow-on question for you. So now that the process is complete and the company has the GP assessment report in hand, what would typically happen next?
Thanks, Eliza, for laying out what these portions are that we would expect and sort of the readout. And a lot of what happens next kind of depends on whether there are findings, which is really not unusual. This area is so complicated, it's very unlikely that you look under the hood and there's not some sort of area for improvement. But more importantly, it really depends on if there are significant findings, right? Like what level of severity do the findings reach? So in general, what I would suggest or advise is once the GP assessment readout document is there and final, then the suggested next step may be to prepare a management response to this audit or assessment readout. So the GP assessment report already includes suggested possible remediation steps. And the management report really serves to take those steps and fill in more detail of when and how the steps are going to be completed. And then as the actions are completed, the management response document would be updated. So ultimately, it is going to be finalized when the remediation is complete. And so that leaves the company with sort of two documents at hand, right? On the one hand, it's the GP assessment report or readout. And then on the other hand, it's the management response that details how the company addressed any issues that were found. And these two documents together, I kind of view them as sort of the bookends of compliance, right? If there's ever a challenge or doubt as to the company's compliance efforts in this area, these two documents would be a really good shield to kind of defray any of those kind of questions, just because they show significant effort and investment in compliance. And then if there were issues, the management response would show the remediation. Then, of course, from the legal perspective, there's this question of whether one or both of these documents would be under the privilege and what to do with that. But that's the level of detail we don't have to get into here today.
And Chris, you mentioned some of the benefits of the GP assessment. And toward the beginning of our episode, you mentioned that if there's an issue, it's better to find it in-house rather than have the government find it when they're performing an audit. But this process clearly requires a lot of effort and resources. So what are other benefits of going through this process?
Yeah, so let's not forget the Office of the Inspector General's 7 elements of an effective compliance program. So these were first published in the Federal Register back in 2003, but then they were recently refreshed in a publication on the website, and it's still up on the OIG website from 2023. And various elements are kind of relevant for a GP assessment, but let's just focus on element number 6, which is titled Risk Assessment, Auditing, and Monitoring. So we don't have to read through all these details here, but in 2023, OIG basically said, and I'm going to quote here, identifying and addressing risk have always been at the core of compliance programs. In recent years, OIG, the compliance community, and other stakeholders have come to recognize and place increasing emphasis upon the importance of a formal compliance risk assessment process as part of the compliance program. So then there follows quite a bit of detail on this topic, some of which is actually not directed at manufacturers, but at other industry participants. But nevertheless, there are other sources also, such as settlement agreements between pharma manufacturers and the government, that really illustrate what OIG is looking for from manufacturers in terms of an effective compliance program. And certainly periodic auditing and monitoring is a key focus that we see pop up again and again in those kinds of settlements.
Well, Chris, I think you nailed this right on the head, right? So there's clearly a compliance benefit from doing a GP assessment. Eliza, I wonder if you have other thoughts of other benefits that there may be and what other insights that a manufacturer could draw from performing a GP assessment.
Yeah, just to add to the comments that you made, which are very important, the OIG publication. So, from my standpoint, many manufacturers may view GP assessment as a kind of a daunting and often undesirable task. However, when we see the value these assessments provide, their perspective changes given how useful the output is. So, this assessment can be, as you stated, very beneficial for the companies. Although vital, the benefit is often overlooked. As you mentioned, Chris, assessments are critical mechanisms for confirming compliance with these complex government pricing regulations. So I want to discuss why, and that comes down to how the calculations we perform work. The assessment process often uncovers inefficiencies in pricing and reporting practices, and oftentimes any issues we find are not one of problems, they are issues that build up over time. Leading to a potential serious financial risks. For instance, one of the clients we recently worked with, the client hadn't reviewed their government pricing calculation quite a while. They had a complex supply chain with a wide range of products, various complex commercial discounts and rebate practices. Upon taking a close look, we found opportunities to improve their operations and areas where they were out of compliance with rules. And then, as part of a significant remediation effort, we recalculated their government pricing for prior 10 years. So we had to gather organize data from old and current systems, as well as data that didn't exist in any system to make it more systematic. There were a lot of data attributes involved in these calculations that had to be kind of sorted out and accounted for. The undertaking, it required time, resources, given the complexities that had built up over the years. In the instance of these clients, the result revealed repayment obligations. However, if the analysis had revealed undercharges, it's important to note that some government pricing programs do not allow manufacturers to recover undercharges or offset them against repayment obligations. So ultimately, manufacturers can streamline their operations and reduce costs by addressing deficiencies in their government pricing programs early on. The assessment process then also involves benchmarking against industry standards and practices. And manufacturers can gain insights from such a comparison to help implement successful strategies that work in similar organizations. Assessments also can provide valuable insights that can drive continuous improvement within the organization, enforce strategic decisions, help manufacturers adapt to changing regulations and market conditions. Finally, the output from internal assessments can also help manufacturers respond to government auditors. So, as manufacturers embrace these strategies, they have the opportunity to kind of transfer their approach to assessment and might value the opportunities to help create growth and make improvements.
Yeah, thanks, Eliza. Thanks for tying in sort of this point about effectiveness, efficiencies, and strategic benefits with the compliance benefits of the GP assessment. And maybe I can take it a step further. Obviously, the pharma industry has always been highly regulated, and the burdens have just increased continuously in recent years. And let's just mention Inflation Reduction Act and the many changes that were made to the federal programs under that law. But with all these obligations and hurdles, there is still a pathway to success. And let's define success as getting life-saving therapies into the hands of patients. And namely, that pathway is developing strategies that not only comply with the legal obligations so we can, get through the narrow gates here, but that also incorporate the features of this legal environment in order to be successful. And so I'll just mention one random example here, right? Whether a drug is subject to the retail AMP or 5 IAM price reporting, can be very significant in terms of what that AMP number ultimately looks like. So if a company is marketing a drug that's 5I by route of administration, how that's distributed, the choice of distribution channel, could have a very significant impact on Medicaid rebates, impact on 340B ceiling prices. So, in terms of developing strategies, either for new product launches, but for ongoing operations with the product, life cycle planning, the GP overlay is hugely important. And a GP assessment can just help revisit decisions that have been made, how they've been implemented, and just like in your example, uncover problems, but also identify strategic advantages that could lead to some real upside. So it's important, I think, to remember GP assessment, yes, it's driven by a compliance need. And of course, compliance is overarching, but there are major benefits that can be realized from going through a GP assessment.
Right. So it seems that a major takeaway here as we wrap up our podcast episode is that GP assessment has clear compliance benefits, but we should not forget that there are strategic advantages as well. And so, with that, why don't we go to the question that we posed at the very beginning? And that is everyone's favorite question: which Olympic sport is it like? Eliza, I wonder if we can start with you. What do you think? Which Olympic sport is it like?
Yeah, that was not an easy question, honestly. So I put some thought in it. I could see government pricing and government pricing assessment fit with many sports, but at the end, I think for me, it can be linked to gymnastics, specifically in the context of balance beams routines. And here's why. Just as gymnasts must execute their routines with precision and accuracy to score well, companies must ensure that their pricing calculations and reporting are exact to comply with these government pricing regulations. Gymnastics routines also involve a series of complex movements that require careful planning, coordination, and execution. Similarly, government pricing involves navigating complex regulations, requirements. In addition, gymnasts must maintain balance throughout their routines to avoid falls, deductions, and scoring. In the same way, companies must maintain compliance with various government pricing programs to avoid penalties and increased risk of government audits. Gymnasts often train to improve their skills and routines over time. Companies engaged in government pricing also must continuously improve their processes and compliance measure to adapt to changing regulations and market conditions. So, government pricing and government pricing assessments require careful balance of precision, compliance, continuous improvement, much like a gymnast performing on the balance beam. So, Danny, what did you pick?
Well, I think your selection of gymnastics as a sport is fantastic. I'm thinking of equestrian sports, which is riding on horseback. And there's actually three different Olympic disciplines. They are the dressage, eventing, and jumping. But essentially, they all consist of a number of tests in which the horse, the rider, they perform routines that have these very kind of specified movements and these obstacles that they have to clear. But very importantly, and the reason I picked equestrian sports is that the horses need to pass veterinary inspections in order to compete. And I think of these GP assessments that we were talking about today and that Eliza, you explained to us so well. They're kind of like those veterinary inspections, which would allow a manufacturer to safely sell their products in the federal program. So, yeah, for me, it's equestrian sports. Chris, over to you. What Olympic sport do you think this is like?
I think it's awesome. You both picked something where there's a lot of precision involved and a lot of routines and specific steps. I'm going to go here with something that's more of a kind of blunt force thing. I'm going to say weightlifting. As it says on the description, weightlifting tests the strength, power, and technique of the athletes. And so if you've never lifted and you walk up and now you're supposed to lift, you're not going to do well. You might actually hurt yourself when you try. So the only way to succeed at weightlifting is to build up that stamina and lift and lift and lift. So by the time these athletes walk up to the podium, they can lift insane weights. So that kind of lines up with what you both picked, right? Yeah, there's a lot of training involved, a lot of prep. And so I would say building up those muscles that you can, when the time comes, actually walk up and just lift that insane level of weight. That's what the GP assessment allows us to do. If the government does come calling, you don't want to suddenly start to build up your muscles. You need to have those compliance muscles already in place so you can just attack that weight and not have any issues. So thanks very much for your thoughts here on these Olympic sports. And I think that nicely wraps up our podcast. And as always, we'll turn to Danny and say, Danny, where are we going for the after party?
Well, Chris, I was thinking about it today and I couldn't remember if we've already, in one of our previous episodes, said that we want to go to our very special place, Ocean Air. But Chris and I have been there a couple times. I think we should show Eliza our favorite dish, which is beautiful baked Alaska, and is also quite possibly the largest dessert I've seen in my life. So I don't know, Eliza and Chris, what do you guys think?
Sounds great. Can't wait.
Yeah, I'm on board. The desserts are the key for me. So yes, baked Alaska. You don't see that in many places, but Ocean Air, they are still doing that for sure. Thanks to Eliza for joining us today and sharing insights on government pricing assessments and their importance for compliance and other benefits. And thanks to Danny for being a moderator.
Thank you for having me on the podcast.
Thanks, Chris. It was a pleasure to be here again.
And thank you to our listeners for checking out the Latham & Watkins Drug Pricing and Market Access series, which is part of our Connected with Latham podcast. You can subscribe and listen to new and archived episodes of Latham's podcasts on lw.com, Apple Podcasts, Spotify, or anywhere else you listen to podcasts. If you have questions or would like additional information, please email us using the links located in the show description. We hope you'll join us again next time.
This podcast is provided as a service of Latham & Watkins LLP. Listening to this podcast does not create an attorney-client relationship between you and Latham & Watkins LLP, and you should not send confidential information to Latham & Watkins LLP. While we make every effort to assure that the content of this podcast is accurate, comprehensive, and current, we do not warrant or guarantee any of those things. And you may not rely on this podcast as a substitute for legal research and/or consulting a qualified attorney. Listening to this podcast is not a substitute for engaging a lawyer to advise you on your individual needs. Should you require legal advice on the issues covered in this podcast, please consult a qualified attorney. Under New York's Code of Professional Responsibility, portions of this communication contain attorney advertising. Prior results do not guarantee a similar outcome. Results depend upon a variety of factors unique to each representation. Please direct all inquiries regarding the conduct of Latham & Watkins attorneys under the New York's disciplinary rules to Latham & Watkins LLP, 1271 Avenue of the Americas, New York, New York, 10020. Phone number 1-212-906-1200.